Hello, everyone. Welcome to Stanford Care's monthly community health talk series. My name is Ariana, and I'm a first-year physician assistant student. I'm pleased to bring you this series of talks co-sponsored by Stanford Care, Stanford Health Library, and the Vincent V.C. Wu Memorial Foundation. I'm very pleased to welcome Dr. Grant Smith and Jean Ye, who will speak on navigating serious illness, palliative care perspectives across Asian and Western cultures. Western and Asian cultures often have differing values that influence end-of-life care. Understanding these differences can help patients, families, and healthcare professionals collaborate to provide culturally respectful care. Recognizing potential conflicts allows for preparatory discussions, fostering harmony across cultures. This session will explore EOL or end-of-life experiences in the United States versus Asian countries and differences between Asian Americans and Caucasian Americans. We will discuss how cultural values shape these experiences and offer practical guidance for families to navigate serious illness and engage in effective care planning. Resources for initiating conversations with loved ones and healthcare providers will also be provided. A little bit about our speakers today. Dr. Grant Smith is a clinical associate professor of medicine at Stanford School of Medicine and the medical director of the Stanford Palliative Care Community Partnerships team. He trained at Harvard Medical School and UCSF, specializing in hospice and palliative medicine. Jean Ye, MBA, is a medical interpreter at Stanford Healthcare and former board chair of the Chinese American Coalition for Compassionate Care. Jean has extensive experience in advanced illness and end-of-life care, focusing on Chinese American communities. We're so grateful to have Dr. Smith and Jean with us today. I'll go ahead and pass it over to Dr. Smith to get us started.
Thank you so much, Ariana, and it is such a pleasure to be here with this group. We want to thank the Center for Asian Health Research and Education for inviting us. And I'll pass it over to Jean to say hello and introduce herself as well.
Hi, everyone. It is such an honor to be able to do the presentation with Dr. Smith today. I also want to thank Dr. Brian Ling, who is the co-founder for the Stanford Center for Asian Research and Education. He is using his own life experience to teach the patient, to teach the community. Just want to give him a shout out.
Thank you, Jean. And as we get started tonight, I just want to recognize that we're all here to talk about navigating serious illness. And that can sometimes be anxiety provoking and can bring up strong feelings. And as mentioned, as part of talking about navigating serious illness, we'll also be talking about facing end of life as part of a serious or a difficult illness. And again, that can bring up emotions. It might bring up memories of individuals or loved ones who have lived with difficult illness previously, or maybe you, a family member, a friend, a loved one, is currently living with a serious or life-threatening illness. And I just want to acknowledge that this can be emotional and it's very personal. So I ask that all of us who are here to just be kind, gentle, gracious with ourselves, with each other who are here on this webinar together, and with me and Jean as we try to share our thoughts about this topic. I also wanted to share a little bit about kind of why Jean and I are here. And from my perspective, my greatest hope in the work that I do is that I can try to help make what is often one of the worst times in someone's lives a little bit better. And I kind of hope that for everyone who's on this call. So whether you're a healthcare provider, a community member, a family member, that all of us together can help people and families who are living with a serious or difficult illness feel a little bit more prepared, a little bit less alone, and try to make facing a difficult illness a little bit less stressful. Jean, would you care to share kind of what's bringing you here tonight?
I've been a volunteer for end-of-life community for the past 10, 15 years. Just like Dr. Smith, I want to help people at the most difficult time of their life to bring some peace and calmness into that most precious moment that we can share with our family.
Thank you so much, Jean. And I think Jean and I together, we work a lot together in the hospital, and we've seen times when I guess some of the hardest parts of our job can be seeing a family that maybe is having conflict among themselves, or perhaps conflict between themselves and the healthcare providers, where there is an agreement about how to navigate a serious illness or how to navigate the final phase of an illness. And then Jean and I also have seen incredible times when there is harmony and agreement, and kind of the beauty of human experience can happen through a serious illness or at the end of life, when there is harmony among patients, their family members, and the healthcare team. And so we're here to really hope that we can help more people have that latter experience that is full of healing, joy, love throughout a difficult time. A few kind of disclaimers and disclosures. First, Jean and I have no financial disclosures to make. We're here because we're very passionate about this topic. I want to acknowledge that all of us here have some implicit and unconscious biases. Jean and I have done our best to try to check those at the door, but acknowledge those are still there. And while I wish I had lived 1,000 lives that could carry all that knowledge forward, Jean and I also just have our singular lived experiences. So we're doing the best with what we've come to learn through our work and through our training. I also really want to take a moment that tonight we're going to be talking about Caucasian populations, Asian populations, and just want to acknowledge that no culture, no single culture is a monolith, that there is incredible diversity and variability between Caucasian individuals, people of Asian descent. So unfortunately, our research hasn't quite caught up with the reality of the diversity of the world. So a lot of the research we have has had a somewhat reductive approach to this and grouped Asian individuals together, white individuals together. We'll be doing our best to talk about the research as it is, while acknowledging that it's not perfect. So just want to acknowledge that there is somewhat of a reductive nature there. A lot of the data that we're going to be sharing and kind of the stories we'll be sharing has been from the Chinese American community. That's just where there's been the most research. So kind of take that information as you're hearing more this evening. With those disclaimers in mind, I will say that between myself and Jean, we have decades of clinical experience in this field. And we do represent two very different backgrounds and cultures. So we hope that that will be helpful in sharing the information we have today. And we have a lot of relevant clinical experience, and we've certainly brushed up on the research in this area for tonight. So our roadmap for this evening, we're going to start by talking about what are the differences in the serious illness experiences between Asian individuals and Western cultures. We'll explore together, why do these differences exist? And then we'll talk a bit about how can patients and families really make sure they get the care that they want. So already I've been using this phrase tonight, serious illness. And I just want to say, what do we mean when we talk about a serious illness? And first, I would say that that can be any illness that's life-limiting, or that might have a significant impact on someone's physical, emotional, psychological, spiritual, practical well-being, can be a serious or difficult illness. Some of the common diagnoses that come to mind are cancer, advanced or progressive heart, liver, kidney, or lung disease, neurologic illnesses like dementia, Parkinson's disease, or ALS. Sometimes a serious illness can be something that may be hard to define, but someone is having maybe more time that they're spending in the hospital, or repeat or recurrent hospitalizations, or they're becoming more dependent on daily activities and needing more and more help with daily life. So that's what we mean when we talk about a serious illness. We're here tonight to talk about navigating the course of a serious illness. And I wanted to share some of the research and patterns that have been described about different trajectories of serious illness. So we're going to be looking at a few graphs. And on the graphs I'm going to show, on that horizontal or x-axis is time. And on the y or the vertical axis is function. Think of function as basically maybe how independent someone is, or how much of their daily activities they can do on their own. I think many people who I've talked to clinically, and I think in my own personal life, kind of hope that they are perfectly healthy, right up until the end of their life. A lot of people say, gosh, I hope when I go, that it will be in my sleep, painless, and just instantly. So that would be kind of defined by these researchers as sort of sudden death. You're kind of in perfect state of health. 1 minute you're perfect, the next minute you're gone. It turns out that probably only about 5 to 15% of the population actually has that experience at the end of life. Some more common trajectories might be terminal illness. So an example of this might be someone who has maybe an aggressive metastatic cancer that isn't responding well to treatment. In cases like that, someone might have a pretty steep decline in their function that could happen relatively quickly without a lot of intermittent periods of being healthy again. Some other trajectories that are described in research or are classic for what we might call organ failure. So heart failure is a good example. When someone's heart isn't pumping quite so well, sometimes they can go through these episodes of having a really tough time with their heart failure, having a lot of extra fluid in their body. They might go to the hospital, they get medications adjusted, and they feel a whole lot better, almost back to where they were before they came into the hospital. But still, over time, there's this gradual decline. I think actually cancer is starting to look a lot more like this trajectory because of all the amazing innovations and treatment advances that have happened in that field. But this kind of pattern of an overall trajectory downward, but with ups and downs along the way. The final trajectory I just wanted to mention is a trajectory we often define around dementia, where someone might be quite functionally impaired, but could live for quite a long time in that relatively impaired state. The big picture here is that, and the main take home is that most people will face decisions about their healthcare and have some time where they are on one of these other trajectories. And they'll face decisions about what treatments will I accept, what treatments will I decline. And at some point, those decisions will be about what do I want the end of my life to look like? What care would I want? What are the trade offs that I'm willing to make? So I just wanted to have that as a frame for kind of the remainder of our discussion, knowing that that's something that many people will face. Next, I'm going to pass it over to Jean to talk about how is the experience of serious illness different between people of Asian descent and Western cultures based on the somewhat reductive, but the literature and research that we have.
Thank you, Dr. Smith. Dr. Smith just mentioned that most of us sometime in our life will face the decision what to make for our medical care. In Chinese saying that everyone will go through birth, aging, illness, and death. I'm pretty sure that most of us prepare for the birth of a child with joy and everything. I think we really should look at how to prepare for the end too. And that will be the best gift that we can leave our family. Because Asian's culture and our tradition, we are more likely to receive aggressive treatment at the end of the life. The following statistic is comparing to the non-Hispanic white people. So Chinese people are more likely to have at least one ICU admission and more than one time hospitalization and longer hospitalization too. And remittance in ER is a common thing that we see quite often. And more likely we will die in the hospital. And because we are not sure what is hospice, this is a relative new term for us. And I think it's not just for Asian, it's for Western culture too. I will just briefly say what's hospice. Hospice care is only for patients that expectancy of a life expectancy is less than 6 months. And the treatment is going to be focusing on comfort care, not curative treatments. And patient has the choice to sign into the hospice care, but they also have the choice to leave the hospice care. And when they become better, they can leave hospice care. But since a lot of people don't understand what hospice is, so Asian people tend to have hesitate to go into the hospice services, then lead to a shorter hospice length of stays. Looking at this research here, we can see that Asian has the lowest percentage that they would like to talk about decision maker, about their Medicare they want at the end of life. On top of that, even though they want to talk about it, there are fewer of them to really document it. But just he said and she said. Without documentation, it really resulted in argument among family member and creating a chaos at end of life. So why is Asian going through this? There is a lot of attribute to it. First is because our tradition. In the Western medicine, they emphasize on individuality and autonomy, and they want to talk to the patient directly and only want to hear the opinion of the patient, and also do based on the biomedical model, everything is science basis. Your lab work, your everything is all the tests shows what needs to be done, and they tell you exactly what the lab shows. And also because of the secular differences, that's causing the difference there. But looking at the Eastern side, our value is totally different. The Eastern medication, we don't see a person as an individual. We see as a group. It's my family. My family is a unit, not myself as a unit. And also, due to the 5,000-year tradition of filial piety, the children will never dare to bring up about, Mom, how do you want to handle your end-of-life situation? This is definitely no. But I also want to caution you, it's not just the children doesn't like to talk about it. Even when I talk to my own children, my children will say, Mom, don't talk about this. You are too pessimistic. You're fine. You don't need to talk about it. And I say, yes, I want to be prepared for myself and for you too, because I feel if I am prepared, that's the best gift that I can leave for you. And also in the Asian culture, we look at a person as a whole person. We treat the whole body, not just like cancer, lung cancer, you treat lung, or liver cancer, you treat liver. We look at the whole person. So a lot of people are hesitating taking medication because they are concerned. Even though they're at an end stage of lung cancer, they're still worried about taking the medication or taking the chemo is going to hurt their liver. Also, Chinese culture, we respect the authority and hierarchy. When I said authority, doctors, I remember in the hospital with my dad, when the doctor comes to come do the rounding, I was just sitting there and chatting and listening to the doctor, and my dad turned to me and said, stand up, the doctor's here. I have to stand up right away because I need to show my respect. And Chinese like to kind of hint people, indirect way of talking. There is a saying in Chinese saying that everything is in the unspoken. 一切尽在不言中, for those people who can understand Chinese. So it's really hard, not just for the family, but also for the doctor trying to figure out what they can do for you. Next, please. And we also concerned about, it's really a taboo to talk about end of life when you're healthy. And it feels like by talking about death, you will hasten death, which that causes Asian people try to delay their advanced healthcare planning. And they don't want to talk about it until death is unavoidable. They feel that by doing that, they are trying to lessen the burden on others. But like I just said, if you have planned everything well, you are actually giving a precious gift to all the people around you. And so, and also we like to use indirect conversation. And a lot of people in Asia, like in Taiwan or in China, people actually prefer to die at home. They will have the ambulance send them home before they die. So they feel that dying at home is the best. But in the United States, even your Asian descent, sometimes a lot of people prefer to die in a hospital because we know in the real estate market in the United States, if there's somebody passed in the house in the 3 years period, they need to disclose it. So parents, out of loving their children, don't want to have their children to have this disadvantage. So they prefer to die in the hospital. I'm sure that a lot of people have seen this movie, The Farewell. It's a family. The grandma has a cancer, but nobody wants to talk to her about it. But the granddaughter coming from the United States said, "How can you not tell grandma that she has cancer? She needs to know." This is the difference between, really define the difference between Asian, because from the people in Asia, they feel that by not telling the patient is relief that it's less to have less burden on the patient so they can enjoy a happy life. But from the Western culture and saying, you need to let them know so they know they don't have much time, they can plan accordingly. So this is just different angle looking at the same thing.
And Gene, I think one thing that I think about with this movie too is this is within a single family. This highlights some of the generational differences that can exist. It can sometimes have to do with how sort of acculturation and sort of distance from immigration, those types of things, like they're all at play. And so it is, it's complex.
Oh, definitely. I came to the US with 2 suitcases, and my kids are all born here. When I talk to them, sometimes they talk to me and say, "Mom, you're so Chinese." I say, "I am Chinese." Even though I speak English, I am Chinese. And even though I try my best to distill the Chinese thinking to them, they are still a Western boys. So I really encourage people to start the conversation. This is a conversation, it's only the beginning. You have to keep going back and repeat it again and again and dig deeper, because situation change. The things that you want to be done is going to be different. And so we just need to revisit and we need to be open. Because like I said, that is something that we cannot avoid. We need to embrace it and take care of it and plan for it. Sometimes in a hospital, we see conflicts. We see a lot of family meeting. And so it's really tricky when I'm dealing with a non-English speaking patient. I strongly encourage the medical provider to use skilled interpreters, because we are trained, specially trained to handle this situation. The word choice is very, very important. And also, not only as an interpreter, we not only interpret the meaning of the word, we are also a culture broker, because we come from that culture. We can notice the nuance that the provider does not know. And so quite often when the patient is admitted in the hospital, we will ask their code status. And quite often we can see the patient open their eyes. "Why are you asking me this?" Okay, but this is a common practice in the hospital. Nobody knows what's going to happen next. We hope the worst doesn't come, but in case it happened, what do you need to do? You need to let the hospital know so we can act according to your wishes. And nowadays in primary care, The quality measures really incentivize the advanced care planning in geriatric. Quite often, doctor will bring out advanced care directive to ask the patient to complete, so they know what the patient's wishes are. And also in the oncology department, there are multiple projects to increase the documentation of patients' goal and value, because everybody is different. No matter what's your culture, within the culture, there are differences too. So we need to respect individual wishes. That's our job.
Thank you so much, Jean, for reviewing that. And I think as we continue, we want to talk more about, so we've kind of talked about there can be different values across cultures. And again, we're using this as an example, but this applies to anyone from any culture within a culture, again, all that variety and diversity that exists. So within that, how can you advocate to get what you and your family want and hopefully prevent conflict and try to achieve that harmony that we all are hoping for? And one of the things I would recommend is to understand your options for advanced care planning. And we think of advanced care planning really as a process, so an iterative process, something that can be revisited time and again, of letting family, friends, and your healthcare providers know about the goals, values, and priorities that are most important to you. I really feel that these conversations can help not just with thinking about the future, actually, but even to think about maybe treatment decisions you're facing in the moment. Thinking about how you'll prioritize maybe the diverse priorities that exist within yourself, within your family, society, culture. Advanced care planning, this topic, it certainly can include conversations, but also sometimes that can include completing forms about your wishes. I'd also really advise individuals and families to be upfront about what you want. This idea of advanced care planning, talking with your healthcare provider, is a time to express what your wishes are. And that can include choosing a surrogate decision maker. A surrogate decision maker is someone who would step in to help make medical decisions for you if something happened where you weren't able to communicate your own wishes. This is a time where you can think about, what are my personal, familial, cultural, societal values and norms that direct me to who the right person is to choose? Certainly from a Western medical perspective, we often advocate, we really want to make sure that that person can represent you and represent what you would want. But again, this is where the values for your family might come in to help select who that right person is. You also can choose what amount of information you want to know and be upfront about that with your providers. I think Jean and I have both seen cases where an individual may not want to know all the details about their diagnosis or their lab results or imaging. They might even defer decision-making about treatment options to family members, even though that person could do that, but they would prefer that the family decide for them. And that's something that we want to respect and honor. I would say that in Western medicine, providers will want to confirm with the individual, because of that strong value of autonomy, that the individual is truly okay deferring decision-making or deferring information to family members first. So I would just be aware that coming into the Western medical practices, providers will want to confirm that that's the wish of the individual. Again, on this sort of theme of being upfront about what you want, Jean and I would encourage you to think about what those values are and how would you prioritize those values. Some of these values are maybe in conflict or are on a dichotomy or a spectrum, and thinking about how you might balance these things can be really important. So how would filial piety line up against autonomy? Where does family harmony fit into that? And I would encourage you also to think about some of the big questions that can sometimes come up when navigating a serious illness. And I want to talk about a few of those now. I think one of the questions that Jean and I see people having to think through, and the goals and values they may have to struggle with, is thinking about quality of life versus quantity of life. Now, fortunately, in most of medicine, we get both of those things with our treatments. Most of medicine is all about helping you feel better, live longer, be more active, be more functional, and thank goodness for all the advances that we've had in medical practice. And when people are living with a serious illness, and as they may approach more advanced stages of their illness, sometimes there start to be real trade-offs that doing an intervention or a treatment that might help you to live longer might really have an impact on your quality of life. And that can go both ways. So thinking about how you value those two values and how you would value them if they started to become in conflict is a question to think about. And how you feel about that balance might be really different as things change, as someone gets older, as the underlying illness changes.
Yeah, I have to echo the importance of this quality of life or quantity of life. Everybody has their preference. There's no right and wrong, and the doctors will respect that. But we need to truly understand what's the quality of life, what quality of life means to this patient, not to the family member. It's to for that person. So I just want to emphasize that.
Thank you so much, Jean. I think another kind of dichotomy here, two different values to think about is that autonomy. How much does the individual person want to be involved, be a decision maker, versus how much to defer to family or how much to allow a family member or a group family to make decisions? I think a question that can be hard to think about, but is sometimes helpful to talk through is, what does a good death look like? Where does someone want to be? What do you want around you? What sounds, what foods, what people? Where does that feel right? Another question we sometimes face, especially towards the end of life, is thinking about, are the treatments we're providing, are they help prolonging living and life that is meaningful and that brings that person meaning and joy? Or are our treatments prolonging a dying process? This is so incredibly personal. These are just questions to perhaps think about, to perhaps reflect on, especially if you are or know someone living with a serious or difficult illness. I'd also recommend that people know about the resources that are available to you to help navigate this and to help think through these questions. I'm one of the doctors on our palliative care team, and palliative care can really be a great resource for helping patients of all backgrounds navigate difficult illness. We know that a lot of people don't know what palliative care is or may have understandings about it. So just to talk briefly about it, it's specialized healthcare for people living with a serious or difficult illness. And palliative care focuses on providing relief from the symptoms and the stress of an illness. The goal is to improve quality of life, and that's really for both the individual with the illness and their family, whether that's friends, blood family, chosen family, whoever is in that person's life that's important to them. And it's provided by a team who works with the individual's other doctors. And it's really an extra and sometimes very essential layer of support. And getting palliative care is based on the needs of the individual, not on a specific prognosis. So palliative care actually can be appropriate at any age or any point in a serious or difficult illness, and it can be delivered alongside curative treatment. So in my clinic, I might see someone who actually is going to be cured of their underlying illness, but they're going through a rough time, whether that's with physical symptoms, emotional symptoms. So we really can help out throughout the course of a difficult illness. And I bring up palliative care tonight because we know that when we look at some of the research about comparing sort of non-Hispanic Caucasian to individuals of Asian descent, we know that those folks from Asian background might be half as likely to know about palliative care and be much more likely to believe that palliative care means giving up. And I hope you heard in that definition I just talked about that it's not about giving up. It's actually about having a good quality of life while you're going through a hard time. And we know there can be more misconceptions. When lack of awareness, inaccurate knowledge, misperceptions, or negative attitudes combine, it means that people may not have access or may not be asking for or accepting of this extra support for individuals. So just wanted to make sure that folks know about that. Speaking of resources, we want to provide some extra resources that are available both within our Stanford community here and more broadly. If palliative care is something that you think could be helpful for you or a loved one, you can ask your medical team for a referral. Here in the Bay Area, we are very lucky to have palliative care teams throughout the Bay that are great. To learn more, our Stanford Palliative Care team puts on quarterly introduction to palliative care webinars. So kind of like this, but we talk a lot more about palliative care, what it is, how to access it, how it can be helpful. So you're welcome to come to one of those. We've got the QR code here on the far right if you're interested in that. And we can make sure to get additional resources to those who registered. We also offer quarterly virtual advanced care planning workshops. So if you feel like you'd like to dive into some of those questions, learn more about how to start talking to your family, how to start talking to your doctors about this topic, we offer quarterly virtual workshops. And so the QR code is there to sign up for those as well. And I also wanted to share a few Asian-specific resources. In a moment, Jean is going to tell us a lot more about the Chinese American Coalition for Compassionate Care, which is an incredible organization we've been lucky to work with. There's also the New Hope Cancer Care Foundation, Chinese Cancer Care Foundation that's based in the Bay Area, helping support individuals living with cancer. Some of you may know in San Jose, they just opened the Vietnamese American Service Center, which is a great building that has a lot of educational and resource connection for the Vietnamese community. The Alzheimer's Association has done an incredible job with Chinese language resources for families and individuals living with dementia and other neurologic diseases. So we have quite a few resources in the Bay Area. And with that, Jean, I'm going to pass it back over to you to talk about the wonderful CACCC program.
Thank you, Dr. Smith. As I mentioned before, I've been with CACCC for the past 10-some years. CACCC, a grassroots Chinese community focused on end of life for Chinese American, hoping to provide environment for Chinese American with dignity and being respected. So we do a lot of community advanced care planning outreach workshop, and we help people to start the conversation with the Heart-to-Heart Cafe. We also have a professional forum to train the medical professional help them how to deal with the Chinese-speaking patient. We do a lot of translation with all different organizations, and also help people. We have even glossary later. We can on the next slide we can see it. We also do caregiver and volunteer training. For caregiver, we provide a mindful self-care program. Caregiving is a very hard task, and as you need stamina, you need to take care of yourself before you can take care of others. So that's why we offer that. And in Northern California and Southern California, we also have the hospital Chinese Volunteer Ambassador Program that can visit the inpatient Chinese-speaking patient to help them with any needs that they need. And we also have a warm line. We don't have a hotline because we don't have funding to support that. But we promise that if you call that phone number, we will get back to you in 24 hours, provide you with all the information that we know. So in the next slide, you can see all the things that we have done in the past 20 years. CACCC was founded in 2005, and we are celebrating our 20th anniversary this year on August 9th in Milpitas. I really hope that you can visit our website and join us for this celebration. We have done a lot, and we help the Chinese community in understanding what end of life is and help them go through this tough period. And main thing I want to talk about is a heart-to-heart cafe. It's an advanced care planning group activities using the CACCC's heart-to-heart card. You can get that if you visit the CACCC website. Dr. Smith has provided that information that you can go in and look. This card helps us to discuss about end-of-life issue over a cup of tea and some dessert. And some of people, I want to applaud you guys to come to today's webinar because we are still in Chinese New Year and we're talking about that. Okay, so if you want to talk about that, you can tell your family member, oh, I went to a seminar today and we'll talk about this. And I really feel this is important. And I think I'm going to do something about it. I'm going to start my advanced care planning. That's a start. Yeah, and heart card has 4 suits, just like a regular deck of poker card. Each suit has represent different concerns: spiritual concern, legal, financial concern, and social concern, and your physical concerns. Of course, 52 cards is not going to cover everything, but that's why we use Joker too. And at the end of the cafe, we also have this summary sheet for you to record everything. And also on the right side is the to-do list. It's your bucket list. What you haven't done that you want to do. You haven't done financial planning, do it. You haven't done a trust, do it. These are the things that we're reminding people to do and using the heart-to-heart. And also heart-to-heart card is only one way to play the card. There's also solitaire style that you can just pass the card to people and have them read through it themselves at their own leisure and provoke them to think. That's one way to play too. It's just a wonderful card. I really encourage you to get a copy and play with it. Then maybe you can open the door for your family to really talk about this. If you ever want to have a heart-to-heart cafe, let us know, email us. We will provide a facilitator and help you with it. And this slide is showing the result from our past heart-to-heart cafe. As you can see, most people say, I don't want to be kept alive by a machine. But still, in the hospital, we see a lot of people in ICU attached with all the tubes are still living. And so you guys can take a look at this. A lot of Chinese people don't want to be a burden for their family. So if you don't want to be a burden on the family, do your advanced care planning. They know what to do, so it's not a burden for them. And so I don't want to suffer. Tell the provider, what do you want to do? Do you want to do CPR? No, you don't want to do CPR. You don't want to do that. Let us know so you won't suffer. So all these can be planned. And so I just want to encourage everyone to start the communication, continue conversation. This is not a one sitting thing that can be done. It's a continued conversation because things change. Your health change, situation change. It's just a continual conversation.
Yeah, thank you so much, Jean, for sharing about CACCC and the heart-to-heart cafes. Just like Jean said, if you're part of a group on this call that you think would benefit from learning more about palliative care, advanced care planning, hospice, to have a heart-to-heart cafe, we're interested in sort of partnering to do those types of activities. You can send an email to palliativecare@stanfordhealthcare.org and we can connect about how we might be able to meet your need. We're able to do, because Jean is working so closely with us to do events in Mandarin, we have the possibility of doing events in Spanish. So we'd be happy to collaborate. On that note, if you're interested in learning more about the things that we're doing for palliative care education out in the community, you can sign up for our quarterly newsletter using this top QR code. And then again, if you have a group that you think would be interested in hearing more about the topics we talked about tonight, you can use this bottom QR code and put in a request, or you can also email at that palliativecare@stanfordhealthcare.org and we can get connected. I think with that, we'd love to take some questions. I can see there's some chat and Q&A, and we got some great questions before. So I'll turn it back over to our organizers to help with Q&A.